Hey, it's Dalton from Grapplers Performance. Today we're going to go over whether or not, if you think you have a tennis elbow but it's lingering, if you've been kind of treating it for weeks and it's not going away, it might actually be your bicep tendon insertion. So a lot of people that have pain out here on the elbow when they're moving, working, kind of pulling and pushing, sometimes if we get the pain that's more on the inside of the elbow, that's where the bicep tendon inserts, and it can be more of a bicep problem than an actual true tennis elbow. A quick way to check for that: tennis elbow usually is painful on the bone on the outside of your elbow, and if you spread your fingers out, try to push your finger down but resist it. If we get pain pushing on any of these three fingers, usually it's more to do with an overloading of the tendon, the common extensor tendon from the elbow. Same thing with the wrist. If we resist it and we get pain there, we're seeing more of a classic tennis elbow symptoms. If that's all fine, but we have pain more on the inside of the arm through here, and when we hold the bicep strong and we try to resist it, and that's what causes the pain, or sometimes little rotations through the wrist, that can be more indicative of a bicep tendon issue. So what we want to do, we can also poke around and see if it's sensitive in here. Also can indicate more of a bicep versus a tennis elbow issue. Typically these bicep problems come on from a lack of movement in your shoulder, and so a quick screen we can do is pulling your shoulder back. We should be able to get the shoulder up behind the back equal to the other side without the shoulder starting to roll and dump forward. When the shoulder comes forward in the socket, it puts excess pressure on the bicep tendon and can start to overload the muscle and the tendon where it attaches. So a quick screen, we've gone over it before, that internal rotation shoulder screen. If you're tight there, we can start to stretch that, and a lot of times it can help offload that bicep tendon. A quick stretch we like to do if you are tight in this position, you feel like your shoulders just kind of want to roll forward when we get our arm behind our back. Strap a band to something nice and sturdy, and that arm, you're going to put it behind the back and step out until that band's pulling your arm behind you. Squeeze the shoulder back, holding on the band, you'll get a big stretch in the front of the shoulder. Hold for about 6 seconds, keep the position, and then we're gonna add more tension to the band. Again, squeeze your shoulder back, letting your arm kind of pull back off your low back. Hold for about 6 seconds, pause, and then add more tension. And we're gonna repeat this process 10 times, trying to get your arm as far as you can behind you and trying to get the shoulder to set back as far as you can. After about a minute, so 10 times, we'll come off of it. What you should feel is a little bit lighter, a little bit looser in the shoulder, and sometimes that can even immediately impact how the bicep feels and how that elbow pain feels. Treat the joint first of the shoulder. After that, we can work on the soft tissues of the actual bicep. When the bicep's extra tight or kind of stuck in a contracted state, it puts extra tension on that tendon where it attaches to the bone. So if we go through and treat the soft tissue of the bicep, it can also feed slack and give some pain relief that's in the elbow. So we can do this with any heavy kind of barbell like we've shown before in previous videos, or we can just kind of go over our bicep with our thumb, find anywhere that's a little bit sensitive, hold on that point, then bend and straighten our elbow underneath it about 10 times. Then we'll come through up the bicep looking for anywhere else that's sensitive, hold on that point, bend and straighten the elbow 10 times, and we can spend a couple minutes just going through looking for any sensitive points in the muscle in order to ease it off. After we go through the soft tissue work, that again should give us a little bit more pain relief inside the elbow joint, and then from there we want to make sure that we ask the muscle to work really hard to make that pain relief more long-term.